to Early Edition. October is Breast Cancer Awareness Month. Among females, breast cancer is the most frequently diagnosed cancer worldwide. In fact, more than 500,000 women died from breast cancer in 2011. That's according to the 2013 World Health Organization's Global Health Estimates. Early this year, the Philippine Obstetrical and Gynecological Society released data stating that the Philippines topped 197 countries with the most number of breast cancer cases. What should us women and men as well know about this disease? Joining us over in our Rockville studio, we have Dr. Aldine Basa. She's a breast surgeon at the Asian Hospital and Medical Center. And we also have Carla Paras-Sison, a breast cancer survivor and the head of the Media and Information Committee of ICANSERVE Foundation. Good morning, ladies. Thank you so much for joining us to talk about this very important topic.
Good morning.
Good morning.
Well, Dr. Basa, I want to start with you first. You know, we were reading some of these statistics. The Philippines has the highest incidence of breast cancer in Southeast Asia, the highest among 197 countries. Another statistic I read, 1 in 13 Filipinos are affected by this. Why are Filipinos really vulnerable to this disease?
Well, actually, up to now, we don't know why Filipinos are, why it's so common here compared to other countries. But, people have speculated that because, the U.S. is #1 in the world and they have a very high fat diet, our diet is similar to the diet in the U.S., which is high fat. So, they're speculating that it may be because of the diet, but really there is no evidence, to show why it's really, the incidence is high here.
Well, at least we do know that detection is key. We'll talk about that a little bit later, but yes. What do we know what causes it, or at least what the biggest risk factors are?
Okay, right now we don't really know what causes breast cancer. But we know that there are risk factors that increases one's risk for getting it. So, for example, age. As you age, your risk increases. Okay, and we know that about 60% of cancers are stimulated by estrogen. So if you have menstruated early, for example, before 12 years old, or you became menopausal late, which is after 50 years old, you've been menstruating for a long time, so the exposure to estrogen is long, so this is a risk factor. If you menstruated early or you became menopausal late, or if you took oral contraceptive pills for more than 2 years, you're adding estrogen to your body, so that will increase your risk, or hormone replacement therapy for menopausal women. If you had a first pregnancy late, which is after 30 years old, that's also a risk factor. And also for obese women, because in the fat cells, it contains the precursor for estrogen. So the more fat you have, the higher your estrogen levels.
Okay, so certainly things to look out for, but not limited to that. Carla, I want to turn to you. Of course, you are a survivor. You were only 35, actually, when you were diagnosed with late-stage cancer. How did you find out? Did you have any of these risk factors? Did you have family history of it?
No, actually, I didn't have family history. Of course, I was still young. I was 35 then. I just found out through, it was actually my husband who found my lump, because we were on vacation and he was comparing. So one breast had a hard feel to it and the other was very supple and soft. And so I thought nothing of it. I said, okay, when we get back from vacation, I'll go to our company doctor and consult, because when you're employed, you actually have an annual physical exam and they do catch these. But then at the time we thought nothing of it, and then just business as usual. Then when we got back, the doctor said you better go to a surgeon, because they usually want to look at it under the microscope. So I was scheduled for excision. And then I went to 3 surgeons, actually, because I still doubted the procedure that was being recommended, but they all recommended the same thing. So what I underwent was a frozen section biopsy. It's still being done now, and in that procedure it says the doctor contracts you to say that if they find breast cancer, they're going to proceed with a mastectomy, because that's a treatment to remove the source of the cancer. And so I signed the form, and then I didn't expect it. I thought, but if in case it was benign, they just remove the lump. But then it was cancerous, it was malignant, so they had to. I woke up without one breast. So that's how it happened.
Wow! Thank God for your husband. Good thing for your husband, right? I mean,
bless his soul. My husband passed away last year, so yeah, he saved my life.
Yeah, that was his gift to you. But I was going to ask though. We are taught really to do our own self-examinations, right, and also see the doctor every year for our women's health exam. So when you were did you do self-examinations? Were you able to detect any of this before that incident?
No, that's why I joined ICANSERVE Foundation. That's the whole start of my advocacy, because ICANSERVE Foundation teaches women from age 20 to do a monthly breast self-exam, and then from age 30 to go for a clinical breast exam every year, because sometimes even if you're familiar with your breast, you do monthly breast self-exam, you still miss it. So I wasn't doing. I was very busy. I was working during the day, and I was studying at night. I was taking my master's at the time, so I was really busy. I didn't have time to do this breast self-exam thing. Although there was already awareness. I knew it was there were risks. I didn't think it would happen to me. So I mean, there are many people like me at the time that they didn't think it would happen to them, and it did. So that's how the whole point of having ICANSERVE Foundation to tell women, you are at risk. Being a woman makes you at risk for breast cancer, so you better do these guidelines.
Okay, we'll talk a little bit about the advocacy of the foundation in a bit. I want to go back to Dr. Basa. Her story is not unique. A lot of young women don't do self-examinations, although that's like the easiest thing to do to detect early, right? Because the chances of surviving are so much higher if you catch it at an early stage. Why do you think the mindset is not there? Is it public education? Are women not being taught in schools about the importance of healthy breasts?
I think now that because of the groups like ICANSERVE and a lot of, because of the internet, there's a lot of awareness. So people know about breast cancer and how it needs to be detected. But I think there is a prevailing misconception that if you don't have a family history, you will not get it. And I find a lot of my patients think that, because they always say to me, Doctora, why did I get breast cancer? I don't have a family history. But it doesn't go that way. 90% of breast cancers are not hereditary. So every woman is at risk, as long as, it can happen to anybody. And this is something that people don't really get yet. And so they don't bother to examine themselves. But those who have a family history are very religious in examining themselves, seeing the doctor. So this is really a myth that we need to continually dispel.
Okay, so just being aware of doing this and being responsible for your own health, right? I think that's the key here, not just relying on our doctors, although that's very important as well. So just give us the basics for maybe some of our viewers who are a little bit unaware of what to look out for. Can you just give us quickly what should be kind of the telltale signs of really breast cancer?
Okay, well, the most common presentation of breast cancer is you feel a lump. Now, it's very difficult to teach somebody how to differentiate a lump that feels benign versus a lump that feels like cancer. So generally, the recommendation is if you feel a lump, you should see a doctor. Do not assume that this is just because of menstruation or this is just nothing. The doctor has to be able to determine what it is, not you. And also, if you examine your breasts monthly, you will be able to detect the change. So the main message here is if you see a change, for example, you've noticed that the skin of your breast is thickened, or the color of the nipple has changed, or you have nipple discharge because that's not normal, or if there's sudden dimpling of the skin, or if the nipple has all of a sudden inverted, these are signs that should alarm you. But remember, anything that you feel that's different, that wasn't there before, you should already consult. Because we shouldn't be waiting to feel a lump. Because in most cases, the lump is already very big, that's why you felt it. It's only, you'll be lucky if it's small because it appeared in the superficial layer. But if it's in the deep part of the breast, you will not feel it if it's small. The only time you'll feel it is if it's very big already.
Yeah, and it's hard
So
because
if yeah,
I was just going to add
any symptoms, you should see a doctor already.
Yeah, and I was just going to add, Dr. Basa, that you know, at that point it could have spread into the bloodstream and to other parts of the body, and that's where the real mortality rate increases. I wanted to turn back to, of course, Carla. You know, again, a strong survivor there. Tell us about your journey. How has it been? How have you been able to overcome, you know, this initial diagnosis and now thrive and be an advocate?
Well, it wasn't easy, of course. You have to undergo the treatment. I had chemotherapy after the surgery, and I had radiotherapy. And then a year later, my doctor found out after a PET scan that it had spread to other parts of my body. That's why it was late stage. It wasn't the first round of treatment wasn't able to eradicate all the cancer, so I had to get treated again, another 6 rounds of chemotherapy. But then with the support of my husband and my friends and family, you know, it took about a year of treatment before, you know, my doctor said, okay, you can rest a bit and we'll see, we'll observe. In fact, the scan after my last treatment, they still showed signs of hyperactivity. That's just saying that there are still hyperactive cells there that could be cancer. But I told my doctor, I've been under treatment for a year, can I rest? So he said, okay, we'll wait another 6 months. And luckily, after the 6 months, after the scan, it was all clear. So I think many breast cancer survivors undergo the same, you know, the scare, what if I die, what will happen to my children? But then with the support of the community and organization support groups, then they pull through somehow.
And now you're part of ICANSERVE Foundation. What are some of the efforts that the foundation is doing to really increase awareness, overcome the stigma? Because I think a lot of people, you know, they don't want to almost admit if there's something there. They're kind of scared to go to the doctor, maybe fearing for the loss of their breast. Is there still that stigma that you'll have to undergo a mastectomy and then, you know, there are no options for, you know, because I guess breasts are so part of being a woman. So I think maybe that's part of that stigma that they don't want to admit to themselves that they have cancer.
This is why early detection is key, because then if you catch it early, maybe you don't have to lose a breast. So what ICANSERVE is doing is that it has this program called Ating Dibdibin, which is in partnership with local government. And what we do is we teach barangay health workers to do clinical breast exams so that the women in the community who are in far places where there are no mammograms, no hospitals, no doctors, they could actually undergo a clinical breast exam annually from age 30 through a trained health worker, because it takes training for the health workers to know what they're looking for. And of course, we teach them, again, breast self-examination. Our other program is OKtober, which is happening this month. A lot of the forums are happening on October 18, and I think Dr. Basa is among our volunteers there. So what we do is we go to communities with partners and teach women really breast self-exam, the guidelines, the clinical breast exam, at what age you should have a mammogram. And of course, the other thing that ICANSERVE that is joining the Cancer Coalition of the Philippines, where it is co-chair, and we are advocating for the adoption of the National Integrated Cancer Control Act, which is like a comprehensive approach to cancer. Because what happens now is like ICANSERVE really focus on breast cancer, because our volunteers, our survivors, our members are breast cancer survivors. But then we have to make a total approach, meaning not only breast cancer, all kinds of cancer, lung cancer, children's cancer, other kinds of cancer. So in coalescing with other groups that have the same advocacy, we believe that the government can implement a program that will address the needs, not just of, you know, working Filipinos, but really all Filipinos.
Yeah, very important. And Dr. Basa, I want to leave the last word to you. What is the biggest message you think as a doctor the Filipino public should know in terms of educating themselves? What's the first thing we should do, especially to raise awareness?
Okay, well, first of all, a lot of women think that when you have a lump, it's cancer. In 80% of the time, it is benign. So it doesn't mean that if there's a lump, it's already cancer. All right, so the key here is, like Carla said, early detection. If we are able to detect cancer early, We have more surgical options, so you don't have to lose the breast. We can preserve the breast. There's so many other options that we can do that give you minimal surgery. So it's less, it will affect your self-esteem and self-confidence less because we're able to preserve the breast.
Okay, and that's important.
And the most importantly is how do we detect breast cancer early, which is through early detection, where we recommend that all women starting 40 years old should have an annual mammogram, whether you feel anything or not. All women starting 40 years old should have a mammogram and ultrasound. At 30 years old, you should already have a clinical breast exam, which is a breast exam done by your trained health professional, which is either the doctor or, in the rural areas, the barangay health workers who are trained. And all women starting 40 years old should do self-breast examination monthly, 1 week after their menstruation.
Okay, good call to action, good tips right there. Thank you so much for joining us, ladies. Dr. Aldine Basa and Carla Paras-Sison of ICANSERVE Foundation sharing their thoughts on Breast Cancer Awareness Month. Thanks so much.
Thank you.